Hey folks, welcome to the Dark Horse Podcast. I'm Dr. Brett Weinstein. So I'm a PhD in biology. My specialty is evolution. I have some background in immunobiology, and I'm going to be acting today in the role of traffic cop sometimes, traffic cop other times, traffic cop, and traffic cop. That's my plan in order to get this very complex story simple enough that people can understand it because it is of the utmost importance. All right. Oh, one other thing I should say is that there's also a final role for me, which is traffic cop. To my right, we have Robert Malone. Robert Malone is an MD, PhD?
No,
Robert, please,
that's fair. So,
Master's and MD. He is also, and most significantly here, the inventor of mRNA vaccine technology from back as a graduate student. Am I correct?
yeah, and I'm also a licensed.
Robert, please,
That's fair.
A licensed physician in Maryland. And to my left is Steve Kirsch, who is a serial entrepreneur. And actually, you want to tell us about your role in COVID treatment research?
Sure. I started the COVID-19 Early Treatment Fund.
We cannot have a rational discussion.
Robert, please, let me. And we fund scientists throughout the world on looking at repurposed drugs for outpatient clinical trials. And because using repurposed drugs is the fastest, safest, and lowest cost way to end the pandemic. Robert, please, let me.
All right, excellent. So I must say that this is a difficult topic for us to address. We all, I believe, are agreed that something very serious is afoot, and the public is largely unaware
Robert,
that they have been placed into a kind of danger. And we also know that there's a great deal of stigma directed at those who would explore these dangers. I know that I personally feel a certain amount of jeopardy over talking about these things, where you get some kind of squid ink phenomenon, where I would imagine you gentlemen feel similarly.
Yeah, I'm particularly concerned by all the censorship.
Robert, please, let me.
We cannot have a rational discussion.
Cannot have a rational discussion. I think it's a very fair way to put it. COVID, vaccine, and ivermectin, we are protected. And you are.
That's fair.
Robert, please, let me. It's kind of like Dorothy in The Wizard of Oz, that she always had the ability to go back to Kansas. We've always had the ability to end this pandemic. It's just a question of whether we want to use it or not.
Well, actually, I'm going to push back slightly on you, Steve. I was actually going to inquire from my friends who are closest to this, but where you get some kind of squid ink phenomenon where.
Yes, we've had the drugs available, and then the know-how we developed late last year.
Right.
Yeah. Okay. So if you'll let me, my pushback.
Robert,
is
please, let me.
That's fair.
We're not going to get bogged down here because it's not the central reason for our conversation.
But my point is that if we were able to, just like we're trying to get everybody to take the vaccine, if we had put that into getting everybody to take ivermectin and fluvoxamine for a month, and if we could accomplish that, then COVID would be wiped out.
What you pointed to is accurate and alarming is an understatement.
And it's just a question of, practically speaking, we agree with you, Robert. It's practically speaking, it's hard to pull off. I'm saying that theoretically, if we could get agreement.
What you pointed to is accurate and alarming is an understatement. I would invite people to look at it for themselves, or you get some kind of squid ink phenomenon. Where
I think the term for a lot.
Hang on, Robert. I know you want to talk, but hang on. I think the feedback that I've gotten is they'll look at it for about 30 seconds and say, I don't believe this, and it's the cognitive dissonance.
Yeah.
It's the people who took the blue pill,
right,
and are living in the matrix, and everything is good, and this can't possibly be true, and they immediately write it off, but they can't cite anything that is wrong with it. They can't argue any of the points, and they'll delve into ad hominem attacks and say, oh, well, this was written by an engineer who doesn't know anything. Right. So, and to me, that's a victory, because it says that everything I've written, they can't argue with. So the only thing left to attack is to try to attack the person when you can't attack the arguments. And that's what people do.
Something has gone wrong. We are in danger, and we are not behaving rationally. And you can detect where we are not behaving rationally.
It's so hard because it's just this unbelievable story. Right. And let me just tell you how it got started.
However it works.
Okay, sure. So it got started when my carpet cleaner came and he was wearing a mask. And I said, hey, we're all vaccinated, you can take it off. And he said, I just got I got the Pfizer vaccine and I had a heart attack 2 minutes later.
Are we too far in the weeds right now?
Cannot have a rational discussion. I think it's a very fair way to put it. Something has gone wrong.
Can't imagine what that would be. I want to say a few things. But what Byron Brittle did is he did a FOIA request to the Japanese government to look at the biodistribution data.
More than fair, and I alerted the FDA about this.
You can go next. Okay. And to be fair, the FDA did not think that the S1 subunit and the spike protein was toxic. And so the FDA knew about the biodistribution. And one of the scary things is that the biodistribution peaks in your ovaries. And
so
hang on, Robert. I know you want to talk, but hang on.
So the whole reason to use an adenoviral vector and mRNA.
Oh, yeah, it's really big now.
Right.
I'll call the fire department.
Right.
I've always had the red pill. I can't imagine what that would be. I want to say a few things. And by the way, we have no problems at all with mRNA vaccines.
What you pointed to is accurate and alarming is an understatement.
Tim says I try to tell my story, and the press ignores him. And we have these groups that aren't able to get attention.
So the censoring has been good.
Robert, please, let me. It changes everybody's mindset into believing it's safe and effective. And when you have that, you don't report these adverse events as being associated with it because you eliminate it.
You don't want to be the fly in the ointment.
Well, no, you don't think it's possible, right? So when a doctor sees a miscarriage.
If you were to ask me, Robert, do you know what the reproductive consequences are?
Robert, please, let me. So we never see any of these safety signals because everybody is trained to think that it's safe. It couldn't have been a vaccine.
So that's this group thing.
Robert, you can go next. Okay.
So I'm a regulatory professional. And
Robert, please, let me. Rodents don't have the same affinities for ACE2.
So we're down in the weeds.
Yeah.
But I just wanted to say,
do it right.
Agreed.
I can't imagine what that would be. I want to say a few things. If you report something, they're going to say, no, they'll convince you that it's not. So I just wanted to say that I didn't just rely on my carpet cleaner story. Because that would be a single anecdote. Oh, yeah, that was just my antenna went up. And then when every place I went, every single place I talked to doctors, I said, oh, you've got 900 patients. How many of them have, what's the adverse event rate, the serious adverse event rate? And so doctors have a view, and I talked to paramedics. They've got a view.
Right.
And I did a survey on Nextdoor.
Just like to add one more log to your fire.
Oh yeah, it's really big now.
Right.
I'll call the fire department.
All right,
You can go next, okay? And found, 3% had persistent troubling symptoms that haven't gone away.
I'm a science person. I want to see the randomized controlled trial. Right.
So every single thing that I looked to verify, it was flashing red.
So you're coming.
Robert, please let me.
We cannot have a rational discussion.
Cannot have a rational discussion. I think it's a very fair way to put it. Something has gone wrong.
Can't imagine what that would be. I want to say a few things, and the FDA doesn't look at it that way. They look at it as
Well, let me just.
hang on, one second. The VAERS system, which is the very
This is
voluntary
vaccine adverse
event reporting system.
Yeah.
Okay, nobody knows about that. They're all told to report into VSafe. They get these text messages that only last for a few weeks or so, but nobody knows about this VAERS system, and people aren't reporting in. In fact, when doctors report in, they
Can I get the little yellow card?
And that thing is going to
hang on, Robert. I know you want to talk, but hang on. They are told, don't report this. This wasn't. We've had reports reversed from doctors, without their consent, without the doctor's consent.
So first of all, I don't want us to work too hard. Where you get some kind of squid ink phenomenon. Where,
yes, and when I looked at the VAERS database and I see like it's flatline for all the 30 years that VAERS has been around, and then it just spikes up. It's like a hockey stick.
So maybe we should.
And then it's like, how do you explain that?
Maybe we should bring up that graphic.
Sure.
So while you're doing that,
Yeah.
And the assumption, by the way, has to be for something like this is you have to assume that it's the vaccine because that's the conservative thing. No, you're going the wrong way. Yep. That was the biodistribution. And then here's this graph. And when I saw this graph, I said, look, that needs to be explained.
Are we too far in the weeds right now? Can I get the little yellow card?
We're not going to get bogged down here because it's not the central reason for our conversation. And that thing is going to,
And the default is when you do a clinical trial is you have to ascribe it to the suspect should be the vaccine because this is what's being tested. And then you need to show that, oh, no, this was due to some other thing.
Okay.
And nobody's explained that. That's the thing. Nobody's even asking the question, how many people have died?
Something has gone wrong. The number
No. They're way backlogged. And also,
the current number is like 6,000, right?
Probably somewhere around there. But they've actually nobody can explain why they've removed reports from the VAERS system because what we found is that the reports that were put in by people and they disappear.
Where you get some kind of squid ink phenomenon. Where,
so this is a conservative estimate because what about those reports that they took out that we can't see?
That's a key point.
Robert, please let me. Yeah, so let's talk about what the alternative is,
right?
Because that's been unfairly. They basically have this evidence, and the NIH and Cliff Lane, by the way, runs the NIH COVID treatment guidelines, and I have told Cliff in many times that fluvoxamine, when it was confirmed in a large phase 3 trial, which is the standard of evidence, I said everybody's waiting for this large, really well done phase 3 trial, and I told him about an interim result that was p-value of 0.05, meets the bar, proves that it really works. There is no doubt.
You're right. You're fundamentally right.
Okay, can I finish, please? Okay. All these people that said, well, ivermectin doesn't work, and I believe in evidence-based medicine, and I would talk to the top officials in India, and then they would say, I believe in evidence-based medicine. I said, here's all the evidence. Here's the systematic review and meta-analysis that you need. That's the highest level of evidence. Look at the evidence. And he says, and the response is, well, the WHO, the WHO, and the NIH don't say, so sorry, I'm not interested.
In our
So that's on the ivermectin story.
Yep.
Okay, that's a sticker.
Robert, please let me.
That just doesn't make sense.
There's something called the precautionary principle. This is really important. Okay, there's a precautionary principle of medicine, and this is what they use for mask wearing because masks, which are mandated, they didn't even have a double-blind randomized controlled trial ever for mask wearing. You did the mandate, and then they did. They couldn't be double-blind because you can't do that. Right? Yeah. Has to be a randomized controlled trial. So they ran. There's one trial in Denmark. Guess what happened? We're
going to give out ice cream. Can I jump in on this? Because
no one was listening to her. And yeah, can I let me finish? Okay. We do it because until we have better data, and they're ignoring that for fluvoxamine and ivermectin because they want to push the vaccine. So there's no alternative.
Yeah, they've reversed it on us.
Yeah.
So this is the third anomaly where you get some kind of squid ink phenomenon where something has gone wrong.
Can I get the little yellow card? You just like to add one more log to your fire.
Can't imagine what that would be. I want to say a few things. So fluvoxamine came out. It was published in JAMA.
So fluvoxamine is an SSRI.
It's an SSRI, and it penetrates the blood-brain barrier, which is great because people have this brain fog. Yep. Okay, and so
I've experienced it.
Yeah, and unlike ivermectin, fluvoxamine goes all the way to the brain, and it calms the inflammation in the brain, and because it activates the signal-1 receptor, which Francis Collins has written extensively about, and saying this is really important. So we have this drug that Francis Collins says, yeah, I love the mechanism of action. We actually tried it. So in the trial, had 100% effect in terms of no hospitalization for the 80 patients in that trial. And then
are we too far in the weeds right now?
Which means in English, that means he agrees. But what should have happened is that NIH should have said, I want to send an investigator down. I want to see if there was any bias. I want to see if there were any confounders. This is like the miracle drug that we've been looking for. They should have sent the entire staff down there.
They did nothing. You want to respond to this? I'd like to respond to.
Robert, please let me. No. Look, both of these were published in peer-reviewed journals, top editor's choice in peer-reviewed journals.
That's just a.
So, but here's the thing. We know what.
But the FDA said, well, well, it was quasi-randomized and people got to choose, but the sicker people chose to take the drug.
This is exactly what I was going to say. The fact is, people do not understand where you get some kind of squid ink phenomenon where
Can't imagine what that would be. I want to say a few things. Oh, look, hey, I got to tell you about my $2 million offer.
we're not going to get bogged down here because it's not the central reason for our conversation.
I offered $1 million if you could prove that the NIH got it right on ivermectin. I offer $1 million if you can prove that the NIH got it right on fluvoxamine.
We cannot have a rational discussion.
What you pointed to is accurate and alarming is an understatement.
More than fair, and I alerted the FDA about this risk. Are we too far in the weeds right now?
No, this is important, right?
Well-
because this is everybody looks to the NIH for these guidance, and the NIH uses these academic principles of what is right instead of saving lives in a pandemic. And that is absolutely wrong.
Actually, I would disagree with you.
Can you give me a pen? They were
But what,
Robert, they
what
were
is-
redacted
what is-
illegally.
Okay,
Well, but what is
we're
clear?
going to table this for the moment. Something has gone wrong.
Can't imagine what that would be. I want to say a few things. I am sure that now that Tess Lowry's systematic review and meta-analysis, which is the highest level of evidence in evidence-based medicine. So once this is published, and this can be published either today or tomorrow.
No, you're talking about her ivermectin.
her ivermectin, yes.
Yes,
Okay.
okay.
So once this is published, I am sure.
Are we too far in the weeds right now?
And that thing is going to,
You're right. You're fundamentally right.
Okay, can I finish, please? Okay.
And
The vaccine.
I've been watching the.
Robert, please let me. The public doesn't know how many people have died
So-
from the vaccine.
I
Which
want,
is
you, I want
kinda-
you to sketch the picture. Of course, we are obligated to err in the right direction. But what does this picture look like? Where you get some kind of squid ink phenomenon where something has gone wrong.
Can't imagine what that would be. I want to say a few things. So in the VAERS database, which is voluntary, the U.S. government commissioned a study to find out how much underreporting this is, and they estimate that it could be only 1% of the reports that are actually reported.
So wait a
that
second.
99 out of 100 don't get reported,
So let's-
which means 5,000 reports translates into 500,000 deaths. And I don't think it's that high.
Right. It's very
Okay.
unlikely to be
It's
that.
unlikely that,
So far.
because right, the mortuaries would be, overrun.
with vaccine deaths.
Okay, so
Right,
what,
it's not that high, but it's higher. I guarantee you, it's higher. And
This is a great opportunity to segue.
Robert, please let me.
Well, that's another can of worms.
Yeah.
Well,
All
but,
right,
okay,
let's
but
put
the
up
point
this-
is that she's got no conflict of interest here. She's been the champion
Fair-
of ivermectin, and then she looked at what was happening in the UK database, and you're seeing the same thing as in VAERS.
So let's look at the data.
her- yeah.
No, but
analysis.
let me
Can
finish. Robert, can I
I
finish?
transition to what we're looking
No,
at?
no,
here?
let me finish. So this is, if you go to the first page, they have a yellow tag system in Britain,
Which
and
means
it is Britain's version of the VAERS system in the US. So it's a voluntary reporting system where, and in Britain, they have 3 vaccines primarily: the AstraZeneca vaccine, the Pfizer vaccine, and the Moderna vaccine.
are we too far in the weeds right now?
No, but
Analysis.
let me
Can I-
finish.
can I- can I-
Robert,
can I-
can I
Can I
finish?
transition to what we're looking
No,
at?
no,
here?
let me finish.
Comment.
Correct.
So all 3 vaccines in the UK
Really, here's
Robert,
now let's look at
no,
the numbers.
wait,
They are based on gene therapy
please, let me finish. Okay, stop interrupting.
technology and are producing.
Robert, please let me finish. Okay, because I know him and you don't.
Can I get the little yellow card?
Well, all right.
Okay,
I'm up for the
all
position.
right. We're it's like I can't even.
No, it's okay.
He's like the
Go ahead.
traffic cop here.
Something has gone wrong.
Can't imagine what that would be. I want to say a few things. Look, I contacted the FDA when I saw this, and I said, "So, what do you think?" They said, "Oh, you should contact a specialist who understands the VAERS data." And I said, I thought I understood it pretty well. I did an analysis on Trial Site News where I show. There's a video on Trial Site News where I do some analysis, and it shows, oh, this is like at least 100 times worse than the flu virus in terms of the deaths.
Flu vaccine.
The flu vaccine in terms of deaths, and I argue actually that's like 1,000 times more than.
And
flu
so
vaccine
that's
in the table.
and that's
In the paper.
that's kind of a straightforward unadjusted
No, but
analysis.
let me
Can I
finish. Robert, can I
can I
finish?
transition to what we're looking
No,
at?
no,
here?
let me finish. Because the FDA told me to go to an expert. So I contacted the Open VAERS people who are looking at this data, and I said, so it says 5,000. What do you guys think based on, you've been doing this for years, what do you think the true number is? And they told me that, of course, nobody really knows. But
Are we too far in the weeds right now?
Robert, please, let me
Really,
Robert,
here's
stop-
Now let's look at the
No,
adverse
wait.
effects.
Because, please, let me finish, okay? Stop interrupting. Yeah.
Because many of these adverse events.
Really, here's
now,
the-
now let's look at the
No,
adverse
wait.
effects.
Something has gone wrong.
Can't imagine what that would be. I want to say a few things. No,
Analysis.
let me
Can I
finish. Robert, can I
can I
finish?
transition to what we're looking
No,
at?
no,
here?
let me finish.
Mhm.
So look, but we should scroll down to her conclusion of this, which says, okay, and she should go and she put this together and got it out quickly. It says the MHRA now has more than enough evidence on the yellow card system to declare the COVID-19 vaccines unsafe for use in humans. Period. Full stop.
I'm of the opinion that we have to have free and open discussion.
Please let me finish. Okay, stop interrupting. Like, why aren't alarm bells going off? 5,000,
Okay, so
excess deaths.
that's my
why
point.
is nobody saying? Why is nobody in academia? Why is no dean of a med school
The thing is-
like saying something? Like, they're all silent. They don't even know. The reason is they don't even look at the VAERS system, because I know a guy. He's vaccinated like 1 million people. Okay,
Well-
and I went to Robert. Please let me finish. Okay, and because I know him and you don't. All right.
All right, we're good.
His
Go
organization
forward.
has vaccinated 1 million people.
There we go.
He is.
Well, all right.
Okay.
I'm up for the
All
position.
right, it's like I can't even.
No, it's okay.
He's like the
Go ahead.
traffic cop here. But I asked him. I said, so, and he says, okay, I'm on the CDC calls every week. Because I'm one of their big vaccinators. And so I said to him, so do you know how many people have been killed by this virus? And he said, it's really, really small. It's like 100.
You mean the vaccine?
Sorry, thank you. By the vaccine, it's really, really small. It's about 100. I said, really? They're telling you it's about 100 because the vSafe system that is not transparent at all to the public. You cannot search it at all. It is like this secret black box that nobody can see inside.
Nor can my colleague.
Robert, please let me. Say
I'm sorry,
something.
but I'm sorry.
Mark Zuckerberg sent an email, and this is in the public domain now, where he sent it to Tony Fauci, and he said, "We will censor anything that goes against the narrative." I mean, essentially, that's what he said.
Yep.
Okay, so when you have a Facebook group of 70,000 people who are vaccine sufferers, that group disappears overnight.
Yep.
We have another Facebook group of COVID vaccine.
It's chaotic. It's disorganized.
Robert, please let me. Say
I'm sorry,
something.
but I'm sorry.
Hang on, Robert. I know you want to talk, but hang on. The 120,000 people disappears overnight.
Yep.
So how could you have, like 200,000 people who are in these COVID vaccine side effect groups, like they would have nothing to talk about,
Right?
Because it's a perfectly safe vaccine. Because it's suppressed, they're buying into the whole thing.
I think
Robert, please let me.
All right, I may have to use. I have never broken this out before, but we're going to be very careful. All right, we're going to be nice to each other, and that thing is going to. Yeah, you have just gotten a foul.
Oh, sorry. I'm sorry. You have to give it to me.
Right.
I thought I was supposed to tape.
I was warning you.
Okay.
Yeah.
Oh, that's a warning. I thought it
Yes.
was who's got the ball, who can speak.
No,
I thought
no.
it was like the chip
no,
thing.
but you got the floor.
Yeah.
Okay, so thank you. So I did a test. I went to a vaccine line in my local pharmacy, and I said, "Hi, I'm thinking about getting the vaccine, but I've heard some things that some people have died. Does anybody know how many people have died from the vaccine? Because I'm not sure what to believe." So one woman says, "Well, I believe in God, and God says that I should go and take the vaccine." And then another guy says, "Are you an anti-vaxxer?"
Are we too far in the weeds right now?
You can go next. Okay. Science is about questioning, and science should be free to question what the narrative is. And there's a phase 3, because even phase 3 studies are never perfect,
And
right?
so-
And so, but the thing is that when I posted this article to Trial Site News, I had a scientific advisory board of 14 academics, very high power academics. All of them resigned like 3 days later, saying that what I was doing, it was irresponsible, that it will cause vaccine hesitancy. I should take it down. They don't want to associate it with me anymore, and don't email me ever again.
I'm a science person. I want to see the randomized controlled trial
That's the smoking gun.
So this is another symptom that is another data point on that line.
where you get some kind of squid ink phenomenon where something has gone wrong.
I can't imagine what that would be. I want to say a few things. And I go on Clubhouse, and I show up in a room.
If you were to ask me, Robert, do you know what the reproductive consequences are?
I would invite people to look at it for themselves.
I can't imagine what that would be. I want to say a few things. Silence.
Right. So again, the thing you should detect at the end of this is not all of the text in the middle. It's that at the end of the day, what's being said doesn't add up. Right?
It's worse than that.
Robert, please let me.
And that thing is going to go for it.
We're sending him home, and we're saying, don't come back until your lips are blue.
Especially when we know, like George Fareed and Brian Tyson, they have a little practice. They treated 6,500 patients. Average age is 60 years old. They have like 0 hospitalizations. They say we only get a hospitalization when someone comes up to us like really late. But anyone who gets to us early, they don't go to the hospital at all. We turn them around with our treatment protocol. So that
we cannot have a rational discussion.
hang on, Robert. I know you want to talk, but hang on. And find out. Why isn't the NIH saying, hey, this guy has 100%
I think
track record?
He just said something that's super important.
Okay.
Oh,
finally.
no, I just like to add one more log to your fire.
I can't imagine what that would be. I want to say a few things.
Can I get the little yellow card?
You want
I asked for the floor.
All right.
the yellow card is a penalty.
I would
Yes,
just
it's a
want to make a
penalty
point to amplify on the good message that you just gave.
I can't imagine what that would be. I want to say a few things. Can you give me a pen?
Yes, I got
You can't get an EUA. We applied for an EUA at the FDA, and they basically said, we're not convinced by your evidence, and and you need to come to us with a drug company to show us how it's going to be made.
I'm a science person. I want to see the randomized controlled trial.
I'm of the opinion that we have to have free and open discussion.
Robert, please let me.
You're right. You're fundamentally right.
Okay, can I finish, please? Okay. So we reached out
Yep.
to all these drug manufacturers. Usually we would get no response at all. And the ones that we did, and I won't say who they were, but thank you for responding, was look, we can't really come up with a financial justification to get involved. And I said, I'll pay for all your expenses. I'll cover all your costs.
Something has gone wrong.
Can I get the little yellow card?
Hang on, Robert. I know you want to talk, but hang on.
And that thing is going to
Can you give me a pen?
We cannot have a rational discussion.
cannot have a rational discussion. I think it's a very fair way to put it. Where you get some kind of squid ink phenomenon where
Absolutely. Peer-reviewed, systematic review and meta-analysis has been overturned because I asked an expert in this area, and I said, hey, what happens if you have the top level of evidence, and you have one systematic review that says it works, and you have another one that says it causes harm? Then how do you resolve that? And she says, well, that's never happened in history, so we don't have to worry about that. So you're advising the WHO to wait is counter to.
I'm not advising.
Robert, please let me. Okay, because we now have this peer-reviewed.
We agree. It is the alternative.
You're being a hypocrite if you're saying, hey, I subscribe to evidence-based medicine and I believe and I believe in the triangle and this is the way it's done, and then they don't do it.
Right.
They don't walk the talk.
It's preposterous. It's an anomaly, and it seems to match the incentives where you get some kind of squid ink phenomenon where
Just like to add one more log to your fire.
I can't imagine what that would be. I want to say a few things. So if you get hospitalized, Robert just said, the doctors or the front lines they're coming up with innovative treatment. I found it's almost the reverse because someone called me because her husband was in one of our hospitals, El Camino Hospital, and she called me for help because he was in bad shape, he's on ICU, and so I'm knowing about these drugs, ciprofloxacin and inhaled adenosine.
You're right. You're
Okay,
fundamentally right.
Okay, can I finish, please? Okay. Right? When people have gone to court to force doctors to give ivermectin, and the hospital doesn't want to do it because if the hospital, hang on, Robert. I know you want to talk, but hang on. The other thing is that in a pandemic, another solution rather than the ferrets and animals is just doctors are always, the outpatient doctors are always trying new things. And so if they report it in to the FDA, that's all we need.
Are we too far in the weeds right now?
Which means, in English, that means he agrees. Right? Because you see all the data coming in and you can see, holy moly, the doctors that are giving the ivermectin fluvoxamine, they've got like no hospitalization repeatedly. And so you can see a signal there. And the final thing, and then Robert, I'll let you talk, is oh yeah, it's really big now.
Right.
I'll call the fire department.
Can I get the little yellow card? It's chaotic. It's disorganized.
We're not going to get bogged down here because it's not the central reason for our conversation.
I would take Bruce up on the offer and I would use all 4 of these drugs.
Okay, so I can speak to that too.
Yeah, okay.
So you hit on 3 things. Let's see if I can remember. Active 6 was one.
What is that?
We'll get there.
Okay.
One is we're going to give out ice cream.
That's the smoking gun. Can you give me a pin? There's another drug which we funded the work on, which is GS441524. And this is an antiviral. It's in fact sort of the precursor to remdesivir. And it works really, really well.
Are we too far in the weeds right now?
No, but let me finish.
Can I transition to what we're looking at?
No,
here?
let me finish.
I'm sorry.
But it's being pursued by Victoria Yan, who's just an individual, and so she's raised some money privately to do this. But it was a long hauler essentially got this drug, and the long hauler said, "Oh my God, I have been a long hauler for like 6 months. I have been in pain. I can't get out of." And a week, or it was like 3 days after taking this GS441524, she said, like, I like back to normal. I have never seen, it's like it was. She couldn't believe it.
Right.
And Gilead is doing nothing.
Right.
On this drug. I mean, it's crazy, and it's much safer than remdesivir. It's much easier to produce, and yet the Gilead has totally dropped the ball.
Can I get the little yellow card? You would like to add one more log to your fire.
I can't imagine what that would be. I want to say a few things. What happened is that the 17-year-old developed Tourette's syndrome as a result of the long haul COVID, and so this doctor said, "Okay, I learned my lesson. I'm going to treat even the kids." And so you have the physicians who are like, "Oh, can't do any harm. Only treat you if you're necessary."
Right.
But this is a virus. You always treat viruses early.
Quickly,
it's like if you had a fire right here on your laptop, you'd be like
we
this.
need a randomized controlled trial to see if water would help.
Right? No. But you take the glass of water and put out the fire. You wouldn't like wait and wait. Oh yeah, it's really big now.
Right.
I'll call the fire department.
No.
And the reason for that is that you're thinking that this virus should be treated, tenderly and gingerly, and let's only put, remember David Ho?
Are we too far in the weeds right now?
Robert, please let me.
Traffic cop.
Well, no. Here's okay. So here's my counter argument. Okay, Robert, you can go next. Okay.
And that thing is going to
So my counter argument is this. So let's take an anecdote. Okay, let's take Dr. Drew.
You're right. You're fundamentally right.
Okay, can I finish, please? Okay.
We're not going to get bogged down here because it's not the central reason for our conversation.
Then we can go and say, okay, we're done.
Right. You've compelled me, right? And the answer is where you get some kind of squid ink phenomenon where my concern, which is real, is minor in comparison to the hazard of COVID.
The third point was active 6.
Oh, right.
Okay, and it's germane. It's germane to this.
Okay. And that thing is going to
I waited. I would not get involved early on.
Hang on, Robert. I know you want to talk, but hang on. Can you give me a pin?
Just like to add one more log to your fire. In cell culture to prove the mechanism of action before we'll allow you to proceed with the trial.
And that thing is going to something has gone wrong.
I can't imagine what that would be. I want to say a few things. Byram Brittle did a freedom of action request of the Japanese government for the Pfizer data, and he got a biodistribution chart. And
that's just wrong.
Yeah. It's tantamount to evil.
I'm pretty sure I linked to the original data in my paper.
I'm a science person. I want to see the randomized controlled trial.
Just to get a little more precise, we've administered by needle.
Robert, please let me.
And that thing is going to
Can I get the little yellow card? You would like to add one more log to your fire.
I can't imagine what that would be. I want to say a few things. Can you give me a pin?
You're just tracking the lipid part of it now.
No. You can go next. Okay. Yes, and it's the cognitive dissonance between what the CDC says is that this is safe.
We cannot have a rational discussion.
Robert, please let me.
Can I get the little yellow card? My friends at the FDA tell me.
Okay.
That are relevant to what you're saying.
Okay.
You're focusing on bone marrow. Mm-hmm. So typically aplastic anemia.
Robert, please let me.
I'm sorry.
Please let me finish. Okay, stop interrupting. Can you give me a pin?
It's different from what the FDA is currently looking at. So these data have been out there a long time. And yes, we have a whole lot of messaging.
But not in public view.
Within the purview, the confidential,
the regulators,
protected, not disclosed purview,
and this is company confidential
of the regulators across the world.
But not
okay?
This
messaging that
company confidential.
So let's not get lost. Yeah, that messaging was inconsistent with these signals that were apparent, at least inside of
the regulators knew
the
about.
data.
Yeah. Okay. So where you get some kind of squid ink phenomenon where
we talked about this earlier. And for me, It's less the lipid component, although that certainly has merit
Yeah.
for autoimmune. It's more the circulating free spike
Oh
protein.
yeah, it's really big now.
Right.
I'll call the fire department.
All right,
Hang on, Robert. I know you want to talk, but hang on.
Something has gone wrong.
I can't imagine what that would be. I want to say a few things. Right, and this is why they always say that there's no such thing as a vaccine that is developed fast. Like the fastest we've ever developed a vaccine has been like 7 years or.
You're right. You're fundamentally right.
Okay, can I finish, please? Okay.
I'm of the opinion that we have to have free and open discussion.
What you pointed to is accurate and alarming is an understatement, where you get some kind of squid ink phenomenon. Where
Yeah, probably unless we go back mid-century when things were loose and fast.
Right, but there's a reason for that. It's not just that. Okay, well, we didn't have the technology. We have better technology now. We still need to be able to see what the long-term
can't-
effects is
you
on a
can't fast
12-year-old.
forward time.
And how do you
Well,
judge the effect on a
that-
12-year-old?
what the animal models give us.
Robert, please let me.
it would be a shame not to try. But,
I'm not sure that's going to happen with Tony Fauci.
no, I got a plan. You'll see.
Okay.
All right. So
It's very good.
So bad.
Yeah, I try to dumb it down a lot, and I talk
Good
about.
job.
I believe we've seen it with mRNA vaccines.
Okay,
in other creatures,
so
is that right?
so there haven't been any mRNA vaccines in other creatures. We are the first creatures that it's being tried to. That's just that.
Ooh.
Okay.
Okay.
But what you're talking about?
Oh, absolutely.
Right.
That's the smoking gun.
What you pointed to is accurate and alarming is an understatement.
So we've been writing and trying to get published papers.
Robert, please let me.
Yes.
See, I got vaccinated because I didn't know any of this. I assumed that what I was being told is the truth. Nobody was dying, and everything was safe, and it was safe and effective. That I was told that, and I trusted the authorities, and I, was just like.
You're right. You're fundamentally right.
Okay, can I finish, please? Okay, please let me finish. Okay, stop interrupting.
Well, all right.
Okay.
I'm up for the
All
precision.
right, it's like I can't even.
No, it's okay.
He's like the
Go
traffic cop here. I've always had the red pill. So, but on this one, I said, there's only so much you can question, right? And when has the CDC ever, misled
So
us?
I
And the
can't
NIH ever
blame
misled us?
blame ignorance. I'm a bona fide.
Robert, please let me.
I waited. I would not get involved early on. There was a lot of reports popping up about vaccines helping with long COVID.
Oh, that makes
and
sense.
number two,
I want to say a few things. They never did any dosing studies to find out whether they were overdosing.
There was-
So hold on. I want to just collect our gains here. Okay. I'm a science person. I want to see the randomized controlled trial.
the one that was unexpected is the coagulopathy.
Robert, please let me. Hang on, Robert. I know you want to talk, but hang on.
Are we too far in the weeds right now?
Which means in English, that means he agrees.
No, it means
He's a scientist. He gets what I mean.
Yeah. I'm translating it for the non-scientists.
The thing that this signal about the relative concentration of these.
You can go next. Okay.
If you were to ask me, Robert, do you know what the reproductive consequences are? We're going to give out ice cream. That's just wrong.
Yeah. No, it's tantamount to evil.
We're going to give out ice cream.
Robert, please let me.
I'm sorry, but I'm sorry.
No, I want to say a few things.
I'm going to look back. There's been times when, as a culture,
Say a few things.
there's been decisions made to cross ethical lines.
Oh yeah, it's really big now.
Right.
I'll call the fire department.
All right.
I've always had the red pill, but I would have done everything in my power to have tried to change their minds. And I don't have any boys, but if it were my children, I would do whatever I could to do that. I think I do not understand this push to let's accelerate the approval of this. Hang on, Robert. I know you want to talk, but hang on. Of this experiment, and to experiment on our kids is to me, and what really frustrates me is I know one of the cabinet members of the Biden administration, and I brought this to his attention numerous times, and he has tried to get the attention of the proper people. And I hear crickets.
The bell doesn't ring.
It doesn't register because it's against the narrative.
Yeah.
And there's a reason for that. It's like, because I sent it to a friend of mine yesterday, and I said, hey, could you get, I tried the secretary, and he wasn't able to get it to Biden's attention. Could you at least get it to, and mention someone who's a top staffer of Pelosi? And so he looked at the document. He probably spent 2 minutes looking at it. And he said, Steve, I love you. I've known you for a long time. You're a great guy. But I should show you the email. But it ended with, and you probably don't think that there was an attack on January 6th. And that is just, it's like, look.
It's gaslighting.
You can go next. Okay. If you want to criticize what I've written, please tell me what's wrong and I'll fix it. And I said, so tell me the truth. You just deleted it when you saw it. He said, no, I didn't delete it. I kept it around, but I didn't forward it like he said he would. He said, forward it to me. I will send it to. So he just,
Cowardice.
Yeah. I mean, this is important, right? I might be right on this. And everything I've seen, every single thing I've seen, from talking to the paramedics, from talking to the doctors, seeing doctors fired, seeing paramedics intimidated, seeing my friends doing the next door surveys, every single time I try to look for, maybe, are they right? And I get nothing. I get confirmation the more I learn. And for me to try to convince an academic, and his argument was, Steve, you must be wrong, because all the academics say that it's safe and effective.
Right.
And you see these posts from...
I'm a science person. I want to see the randomized controlled trial.
Which means, in English, that means he agrees. No, I commented on a post from one of the doctors at UCSF who says, I'm going to vaccinate my kid. And
Are we too far in the weeds right now?
Robert, please, let me...
Can I get the little yellow card?
Something has gone wrong.
Just like to add one more log to your fire.
Can't imagine what that would be. I want to say a few things. Like I wrote to Anna, my Congress woman, and I said, look, here's the document, here's the facts. How do you respond to this? She wrote me a nice letter that says the vaccine is safe and effective. We'll be rolling it out, and the CDC has found no problems. And I'm like going like, well, they haven't even analyzed any of the cases, and they should be assuming that there's a vaccine. Like they halt things, like their stopping criteria, should be 100 deaths or 200.
Right.
Anyway,
Robert's right.
This is always the case when you're at the tip of the
Robert, please let me. He said I was politically incorrect. And
it's the red badge of courage that you're going through this.
You can go next. Okay. Everybody, by the way, everybody advised me because I told people, look, and this is the reason, like Pierre Corey doesn't do this. This is like, you're taking on two albatrosses, right? One is championing early treatment, right? In Brazil, they don't think early treatment works at all, despite all the proof. So you're trying to champion this cause, right? You're going up against the NIH and the WHO. And they said, if you take on also the vaccine, you're done. You're done.
Can I get the little yellow card? You would like to add one more log to your fire.
I can't imagine what that would be. I want to say a few things that nobody is pulling the Andon cord in Congress to say,
well, right.
Stop.
But that's what we've got to do with the Save the World plan here, because I really want to begin to wrap this up.
I would have said something different.
So I have to be careful here. I'm a consultant.
That's the smoking gun.
It's chaotic. It's disorganized.
Please, let me finish, okay? Stop interrupting.
Well, all right.
Okay.
I'm up for the position.
All right, it's like I can't even.
No, it's okay.
He's like the traffic cop here. Can you give me a pen? So I have a different solution.
All right.
Elon tweets a link to this video, and he says everybody should watch this.
Can I get the little yellow card? It's chaotic. It's disorganized.
Which means, in English, that means he agrees.
Well, you guys are operating in a world that I don't touch.
Robert, please let me finish, okay? And because I know him and you don't. So there's another solution too, which is that everybody who is watching this video.
Can I get the little yellow card?
And that thing is going to,
You're going to give out ice cream.
I would have said something different,
or
something. Hang on, Robert. I know you want to talk, but hang on. The only thing that can stop the government is not going to stop these companies from doing the wrong things, but the people who have died.
I think that's crucial what you just said.
You can go next, okay? People who have died from this vaccine don't have a voice. The doctors who want to speak out cannot, because they don't have a voice, especially if you got any kind of NIH funding, if you're in academia, if you speak out, you will never see a dime. You will never get a drug approved again. These agencies have a long, people, I need to, so I'm trying to be the voice for the voiceless, for the vaccine victims who are ignored by the mainstream media. And I just got a tweet yesterday from a woman who says, I run a support group. And hang on, Robert. I know you want to talk, but hang on. One of our members committed suicide because
can I jump in on this? Because
nobody was listening to her. And yeah, can I let me finish? Okay. And a voice for the children, right? Because who is going to speak for the children? Right? Who is going to be the voice of the children here and to speak up for them? And so we have all of these people who are afraid to speak up. And I was told, Steve, they told me, let me advise you, don't touch this issue. It's a third rail. If you touch it, you'll vanish.
I was given the same advice.
Right. And look, I really acknowledge you're taking the risk here, because YouTube may totally demonetize you. Your income will be wiped out. And what you're doing is trying to spread information that's all factual.
Yeah.
But it goes against the narrative.
But what choice?
And so people are afraid to speak out. And everybody I asked, every single person I asked said, Steve, do not do this, because you will get shot down, you will get gaslighted, people will not believe you, and this message of early treatment then will never be heard.
Yeah, but if not this, what? And if not now, when? That's really what it comes down to. Robert?
Two things. The irony is,
which means in English, that means he agrees. I want to say a few things.
Can I get the little yellow card? I waited. I would not get involved early on. We're going to give out ice cream.
For joining us on Dark Horse, Steve Kirsch, Robert Malone.
Thank you.
Thank you.
I really appreciate it.
Thank you for allowing us to be here.
Be well, everyone.